Welcome back, students. In this series of lectures, we are learning the osteology of the thorax. Now, the thoracic cage, as we have learned in the last video, is formed by the 12 thoracic vertebrae, then the 12 pairs of ribs, and the sternum. So, in this video, we will learn about the ribs, which forms the main constituent of the thoracic cage. Now the ribs are curved flat bones, okay, and they form the major part of the thoracic wall. Now, as I said that the ribs are in 12 pairs, means there are 12 right ribs and there are 12 left ribs. Now the length of these ribs increases from rib number 1 to rib number 7. Let us see in this picture here, and then again I will increase the size of this picture so that you can see this thoracic cage. Now in this thoracic cage you can see that the size of the rib, this is the size of the first rib, that is the smallest, then it keeps on increasing till it comes to the 7th rib here. So 7th is the longest rib, and then from 8th, 9th, 10th, 11th is seen hidden here, and this is the 12th rib. They keep on increasing, okay, I will say decreasing. From 8th to 12th they decrease, from 1 to 7th they increase in the size, okay, they increase. Now each rib, if you will see, this articulates posteriorly with the vertebrae. See, any of this rib, if you follow posteriorly, it will articulates with the vertebral column, okay, and the anteriorly they will articulates with that of the costal cartilages, okay, costal cartilages. Now the anterior end of the 1 to 10th rib, okay, 1 to 10th rib from anterior end, they will articulate with the costal cartilage and will form a joint here, that is the costochondral joints, costochondral joint. While the 11th and 12th rib, they are not articulating to the costal, I mean say to that of the other ribs, okay, and their anterior end is free, okay, so they don't articulate with the sternum, okay, their anterior end is free. Now this I can show you in other picture also, where you can see more clearly. Now this picture will show you that this is manibrum sterni, body of the sternum, and the G.P. sternum, and this is the first, second, third, fourth, fifth, sixth, and 7th rib. They articulate with the sternum, and then 9th, 10th, and 11th they also articulate with the sternum through costochondral joint. But then this lower 3 ribs, they are not directly attached to the sternum, but the 8th is attached to 7, then 9th is attached to 8, and 10th costal cartilage is attached to that of the 9th. While 11th rib and 12th rib, they don't attach to the sternum, and then their anterior end is free. Their anterior end is free. Right. So let us come to the classification of the ribs, okay. Let me reduce it. So we now come to the classification of ribs, because there are the ribs which they articulate to sternum, some indirectly articulate, some directly, and some they don't articulate. So this classification of ribs, 12 pairs of rib, is based on the way that some are called as true ribs. So 1 to 7 they are called as the true ribs. Why they are called as the true ribs? Because they articulate directly to the sternum, their anterior end. That's why these ribs are also called as vertebrosternal. Vertebrosternal. See this? Vertebrosternal. Why? Because their anterior end through the costal cartilage, okay, is attached to the lateral margin of the sternum on either sides. That's why first 7 ribs, 1 to 7, they are the true ribs, okay, because they articulate directly with the sternum through the costal cartilages, Then there are the other class of the ribs which are called as the false rib, and this is from 8 to 10, that means 8, 9th and 10, and they are called as the false rib because they don't directly articulate with that of the lateral margin of the sternum, but as I showed you that the 8th will articulate with the 7th costal cartilage, 9th will to the 8th, and 10th will articulate with that of the higher one, okay, that is the 9th one. So till 7 it is the true ribs because they are attaching to the lateral, while 8th, 9th and 10th with their anterior costal cartilaginous, and they will attach to the other two bones, other two costal cartilages, not directly to that of the lateral margin. That's why they are called as false. And then the third category is the floating ribs, and these floating ribs, they don't articulate with any other ribs. They are anterior and are free, okay. So neither they articulate with the costal cartilage of the upper rib, neither they articulate directly to the sternum. They are free, they are short, and it looks as if it is floating, okay. So they are called as floating, and these are 11th and the 12th rib, 11th and the 12th rib. Now this ribs are also classified in one other way, okay. They are also classified, that is, they are said to be typical and atypical ribs. What do you mean by typical ribs? Means where the feature of the ribs, they resemble to each other, okay. That means bony feature of the ribs, they resemble to each other, and all these ribs which have common features, they are called as typical rib, and these are from rib number 3 to rib number 9. So rib number 3 to rib number 9, they are said to be the typical rib, okay. They are said to be the typical rib. While then they are atypical ribs, and atypical ribs means they have their own features which do not resemble with any other rib, okay. They have their specific features which do not resemble to other, and these ribs are 1 and 2, that means first rib, second rib, and then it is the 10th and 11th and 12th rib. So there are 5 ribs which are atypical, where the features, they don't resemble to each other. First rib, second rib, 10th rib, 11th rib and 12th rib. They have their own features, okay. So they are called as atypical. So these were the two classifications to divide the ribs. Let us now, I will tell you very briefly about the general features so as to, which will enable us to determine the side of the rib, because they are, bilateral bones, right side and left side, okay. 12 on right side and 12 on the left side. Now then I will tell you, let us see first in this picture, okay, where I have drawn a rib here, okay, and as I said, the rib is a flat curved long bone, okay, flat curved. Now this is the head, okay, which is towards the vertebral column. That means it is the posterior end. Head is the posterior end of the rib is also. This is the neck, and this part is called as tubercle. This part is called as tubercle. So head, neck and tubercle, and collectively you can call this is the posterior end of the rib, okay. Then this goes more laterally, and then suddenly it bend, and this is called as the angle of the rib, okay. This is called as angle of the rib, and beyond the angle, the whole thing, or still you can say that beyond this tubercle part, okay, then the whole thing is called as the shaft or the body of the rib, okay, in which this angle is located at just lateral to the tubercle, okay, lateral on the shaft. because the shaft begins from lateral to tubercle, goes right up to the anterior end. This is the anterior end, or the end which will articulate with the costal cartilage. Okay, so this is the costal end, also called as sometime. Okay, so these are the features. Now then, if you see these structures in this rib here, then we will see that this is the head of the rib. Okay, this is the head of the rib, this is the neck of the ribs, and this is the tubercle part. So the head, neck, and tubercle, and then from lateral to the tubercle, this is the shaft or the body of which goes right up to the anterior end, which sometimes is called as sternal or costal end. Right. So, and in the shaft, this beyond this tubercle, that means just lateral to the tubercle, this is the point from where this shaft or the body of the rib band. So this is the band angle. So this is called as the angle of the rib. So thus angle is on where from where the rib going to the posterolateral aspect turns and becomes anteriorly, where it starts going anteriorly. So this is the angle of the rib. Okay, now let us see. Thus we can say that each rib has a posterior end, and which is also called as the vertebral end, because it will articulates with the vertebrae, and the other point, that means the other end, is called as the anterior end or the sternal, as it is going to the sternum to articulate through the costal cartilages. So posterior end, anterior end, and a body and a shaft or the body is there. Now let us say a little. The head is the has the articular facet. Just see this. There should be usually two articular facet. Here one is small and another big articular. Here the upper facet, which is a small one, is not very prominent. This one, see this, where the tip of the pencil. So these are the head, and then you will come to the neck. Neck is rough posteriorly and sharp superiorly, and then this is the tubercle. And in tubercle you will see that there are two parts. A articular part where it is smooth. See this oval smooth surface. See this oval, and this is articular, which will articulate with the transverse process. Okay, this will articulate with the transverse process, and then there is an also non-articular part which is rough. Here it is bony projection is seen. Okay, this rough part is the non-articular, and this is the articular. Articular is more towards the medial end, that means to the posterior end or the vertebral end, and non-articular is more laterally located. Okay, then this is the shaft, and shaft is a long curve. Okay, it is long curve. It has a superior border and an inferior border. How you will distinguish superior and inferior border? The superior border is round, okay, and the inferior border is sharp. Okay, when you will feel it with the finger, you will see that the inferior border is sharp border. Okay, thus since there is a superior border and an inferior, it will have two surfaces, shaft, an external or outer surface and internal surface. Okay, inner surface, outer and inner surface. Outer surface is convex and inner surface or internal surface is concave, which is will be forming the thoracic cavity, facing towards the thoracic cavity. Now I think this many bony points are enough for you to identify the side of the bone. And how you will identify the side of the bone? Yes, you know by this time which is anterior end and which is posterior vertebral end, where neck and tubercle is situated. That is the posterior end. So keep the posterior end posteriorly, means towards the median plane where vertebral column is located. Okay, so and then the convexity. Okay, the Convexity of the cause should face laterally and concavity of the jaw of the shaft should face towards the median plane. It should face towards the median plane. And the sharp border, just try to feel with the finger which is sharp and which is rounded, smooth border. The sharp border should face inferiorly. It should face inferiorly. So this rib belongs to which side? Because it is rounded superior border, sharp inferior border is inferior, posterior end is posteriorly towards the median plane or vertebral column. So this rib belongs to the right side. Okay, it belongs. If I will keep it, rest of the points will remain the same. The vertebral end is medially. Okay, the curvature concavity is also medially, but here the sharp border here, see this sharp border is facing upward. That is wrong. It should always face downward. So try to find out the side of some of the ribs. Okay, from your collection or from the department you find out, and then practice how to find the side of a rib. So this is the side determination of a typical rib. We are dealing here with a typical rib, not with the atypical rib. I will tell you about the atypical rib, that is first, second, then 10th, 11th and 12th later. Okay, now let us see how to keep it in anatomical position. Anatomical position, medial and medially towards the vertebral column. Okay, then only thing should be that the posterior end should be at a higher level than that of the anterior end, because it is anterior end goes downward. Okay, it goes downward, and because this rib is also twisted, not very straight. Okay, I cannot show you, but if I show you here, okay, from lateral side the position, the posterior end is at a higher level and anterior end is at a lower level. This is the anatomical position of the rib. Let us come quickly to the general feature of this rib. Look, okay, most of the general features we have already covered. Okay, already covered, but still we will have to see some of the details of the general features. And in the general feature, what we will see, the first we will just learn about the posterior end. So let us come to the posterior end. And the posterior end of a rib has a head, a neck and the tubercle. Okay, these are the parts which are covered in the posterior end. So the posterior most end, that is the head, okay, is having an articular facet. Okay, let me show you here. See, this is a big articular facet in this rib. Okay, on the posterior end, and there is a small articular facet upward, and then there is a raised area in the end, posterior end of the head. Okay, the head. So this is the small articular facet. Okay, articular facet, and with what it will articulate? It will articulate with the body of the vertebra which is above, and then there is a large lower articular facet, and this will articulate with the head, body of the lower vertebrae. That means if I draw it here, this will something like this. Okay, this is the upper vertebrae, this is the lower vertebrae, this will articulate here. Okay, this is the facet, demi-facet for the upper, and then there is a demi-facet for the lower. So the upper facet of the head will articulate to the upper vertebrae. The big large demi-facet or oval facet will articulate with the lower vertebrae here, and in between these two is the intervertebral disc is here. So this is the head, how it will articulate with the three structure, upper vertebrae, lower vertebrae, and in between two it will also articulate with the intervertebral disc. But the articulation with the intervertebral disc is through a ligament which passes through the bony crest, and this bony crest is here between upper and the lower facet, okay, and this crest as seen here in this rib, okay, this is called as the crest of the head, okay, and through this ligament goes and gets attached to that of the intervertebral disc. Now important thing to note is that the large facet will articulate with that of the, or lower facet of the head will articulate with that of the lower vertebrae, and that is the corresponding vertebrae. Say suppose you are dealing with the fourth rib, that means where it is the large facet articulating with the lower, that will be the corresponding fourth thoracic vertebra, fourth rib and fourth. That means the upper small facet is articulating with the upper vertebrae, okay, which is not corresponding to its number, okay, not corresponding to its number. Let us come to then to the neck. The neck of the posterior, and here after head we come to the neck. Neck is sharp near its superior border, okay, and on its posterior surface it is rough for the attachment of a ligament, okay. This ligament is called as costotransverse ligament. Rough area is there, okay, and on the anterior surface the neck is smooth. Anterior surface the neck is smooth, right? And then we come to the tubercle, and as I said, there are two tubercle, that means two parts of the tubercle. One is articular, which has an articular facet, which will articulate with the similar facet on the tip of the transverse process of vertebra to form a joint, what is called as costotransverse joint. So the tip of the transverse process of the corresponding vertebrae will articulate here, okay, to form a joint called as the costotransverse joint. And then the non-articular large part, which is laterally and superiorly to the articular part, this is for the attachment of the ligament, okay, this is for the attachment of the ligament. Now let us now come to the anterior. So we have covered the head, now we are on the anterior end. Let us see the anterior end. An anterior end of the rib here, which you will see here, this anterior end of the rib, if you will see, let me show you. Yes, there is a cup septum, okay, concave depression is seen here. And this, and what will come here to get attached? It is the costal cartilage. Costal cartilage will come to get attached here, which will go and gets it attached to that of the lateral margin of the sternum, okay. This is the primary cartilaginous joint, but the other one is the synovial joint. Other end of the costal cartilage will form synovial, right. So this is the anterior end. Let us come to the shaft. In the shaft, as we have already seen, shaft, okay, this is the thin, flat, curved bone. Thin, flat, curved. Shaft is thin, flat and curved. It has an external convex surface and an internal concave surface, okay, external concave. Now there are two borders we have seen, a superior border, okay, and a sharp inferior. Superior is smooth and rounded, inferior is sharp border, okay, and in the internal surface, okay, internal surface, if you will see, that is the curved concave, then you will see that there is a groove. See this groove is starting from the angle itself, okay. See, this was the sharp margin border, and just above the sharp lower margin on the medial aspect or the curved or concave aspect of the shaft, you will see a groove, and this groove is going along the inferior border for some distance, and mostly between the intermediate part of the rib, and this groove is called as the subcostal groove because it lies below the rib, so it is called as the subcostal groove, okay. Now if you will see the whole shaft, then you will see that there is a twist, there is a band here, which I have said you that it is called as the angle. From after angle it turns, okay, the rib changes its direction. If you will keep this rib onto the table, let me see it here, then these two ends, the anterior end and the posterior end of the ribs, they will not touch to the ground. Either you put it into the wrong direction or onto the to side which it belongs, they will not touch to the table. That means to the horizontal surface they will not touch. Now this is because the rib shows some twisting as it goes forwards and anteriorly. Its shaft twist towards the medial side, that means towards the median plane. So there is a twisting, and this is the reason why the two ends of the rib, they don't touch each other. They don't touch each other. Let us come to some of the features, particular feature. In this diagram, I have shown you the articulation of the posterior end. That posterior end will articulate through the two facets to the two adjacent vertebrae. Here I have shown you only one vertebrae here because it is just a cross section here. This is the neck and this is the tubercle. So this portion articulations I am showing. The most this medial end or the head will articulate with the rib at the costovertebral joint. Let me increase the line. It will articulate with the costovertebral joint. See, that means between the head and the side of the vertebral body. That is costovertebral joint, right? Then there between the tubercle, this tubercle, articular tubercle, and the tip of the transverse process, there is another joint called as costotransverse joint. Costotransverse joint. And then these joints are supported by many ligaments, out of which only 3 I am showing to you. Now this ligament which extend from the posterior surface of the neck of the rib, which I said was a rough area. See, the posterior surface of the neck was rough, while the anterior surface of the neck is smooth, because here it will be the parietal pleura will be in relation. Here the posterior surface of the neck is rough, and this ligament is extending between the neck of the rib to that of the anterior aspect of the transverse process of a vertebra. So this is called as costotransverse ligament. Okay, this is called as, this is on this side also the costotransverse ligament, right? Then second ligament is here that extend from the sharp superior margin of the neck of the rib and goes to the transverse process above. Okay, it will go to the this is called as the superior costotransverse ligament. Superior, because it is going in the superior direction to the transverse process located above. Then from the tip of the transverse process to that of the non-articular part, okay, of the tubercle, this ligament is going, and this will be called as the posterior. It will be called as the posterior costotransverse ligament. Posterior. This was the simply called as costotransverse, and this was the superior costotransverse. Superior costotransverse, and they are just surrounding to the costotransverse joint, okay, and giving strength. One ligament from the head of the radius will go to the body, and that is called as the radiate ligament, okay. Radiate ligament will be there. Let us come to the muscular and vessels in relation to this. Okay, now 3 muscles which are called as intercostal muscles, they are attached to the adjacent side of the ribs. Okay, this muscle which starts from the lower sharp margin of the subcostal groove here to go to the upper border of the lower rib is called as external intercostal. This is called as external intercostal. Okay, then there is a second muscle which starts from the floor of the intercostal space, or intercostal, the subcostal, not intercostal. The floor of the subcostal groove of the upper rib and goes to that of the superior border of the lower rib. This is called as internal intercostal muscle. So there is an external, and then this is an internal intercostal muscle. Then the third muscle in the similar way will begin from the almost from the upper margin of the groove, subcostal groove, and goes to the inner margin of the upper border, and that is called as innermost intercostal. So which are three? Please note down: external intercostal, internal intercostal, and this is the innermost intercostal. Okay, and the blood vessels and nerves will be here, okay, which can be also seen here. There will be a vein, and this nerves and blood vessel will run throughout the length of the subcostal groove and between the innermost and the internal intercostal. Upper one is the vein, then will come the artery. So I will draw the artery with the red color. So this is the intercostal artery, intercostal vein they are named as, and lower down will come the nerve. Okay, so this with the black color I am drawing the nerve. Okay, so the vein, artery, and nerve, they are here. Okay, and this will be their collateral branches of this intercostal vein, artery, and nerve will be seen also above the superior border of the lower vertebrae between intercostal and internal intercostal. This is artery in between. This will be the nerve. I mean to say it will be the nerve, and then this will be the vein close to the bone, as it was here also. So the arrangement is reverse here. Okay, so these are the intercostal vein, intercostal artery, and intercostal nerve and its collateral branches. It will give the branches which will run near the upper border also. Okay, upper border of these structures also. I think this complete the features, bony features, attachment, and the joints of a typical rib. So we have completed a typical rib, and I told you typical rib were from where to where? Third, fourth, fifth, sixth, seventh, and eighth. They were the typical, ninth also. Okay, ninth. So from third to ninth were the typical rib. So we have covered the ribs of thoracic cage from third to ninth. That means the next video will be on the first rib, which is atypical. Okay, first rib. Thank you very much for watching this video.